So thank you both. And now that we have both of you in the panel, let me start with the so I have to come back again. As I said, this was changing as I was looking at it. But let's start with a question from David Perez, that reads, great presentation, thanks. How do you support clients to practice HRV biofeedback at home when they don't have access to the required sensors or software? Do you recommend any reliable, low-cost equipment, free alternatives that still allow meaningful practice and process monitoring? And, certainly, Cassia, you addressed that in your presentation earlier in terms of other methods. But maybe, Melissa, if you can start with you in terms of the role that actually and how we use the equipment, because it's not something that we expect clients to have with them all the time, is it?
Yeah, that's right. And, if you are seeing a client once a week or once a fortnight, then, they're not getting a huge amount of HRV training. But there are a lot of free breathing apps that I use with clients. So I sit there and help them to download these apps, and you can change the pace of breathing, and you can make the in breath and the out breath the same length, or you can make the out breath longer. And so they can go away and do that by themselves. You know, as Hria said, she said, you told me how I could give myself breaks, and I could do this several times a day. So even though she wasn't in a session with me, seeing her heart rate variability, she had the confidence that her physiology was going to respond if she did that kind of breathing that we did in sessions. I think there's actually some technology now where you can like hold a phone and it can read your, oh, you're probably better placed to answer this question, Kasia. But yeah, those breathing apps are free and available.
Cassia, anything you'd like to add?
No, I think with the kids, for some of the parents, the issue about, having phones all the time and relying on phones versus being able to rely on regulating yourself and calming yourself without a device. I think for some of them, it's a real issue because of the problem of, too much technology use, especially like, at nighttime, trying to soothe yourself. So I think there's a sort of balance there, as it's an ongoing challenge.
Thank you. Let's go to the next question that comes from Johanna Nashmi and reads, I'm developing and using clay field therapy with refugees and survivors of trauma. The intervention relies on sustained tactile engagement with clay, bilateral hand contact, warm water, and minimal verbal processing. Do you think HRV could serve as an objective biomarker to evaluate changes in autonomic regulation during this kind of therapy? Who would like to go first?
Melissa, why don't you go first since you're using it a lot?
Yeah, I think you could absolutely do that. I mean, you would have to, the logistics would take some working out, but you could absolutely evaluate somebody's HRV, readings while they are doing the clay fields work. Um, you would have a sensor, I guess, on their ear so that their hands are free. And then, yeah, you would record a session while they were doing their clay fields. And I guess you would have a baseline from when they weren't doing the clay fields. So I think it has a lot of potential for research for sure.
Thank you. Let's go, unless you have something to add, Cassia, we might go to the
No,
next.
I think that's spot on. I agree. Yeah.
Excellent. And this is addressed to you, Cassia. Reads is from also from Hassan, and it reads, great presentation, very informative. Not sure if you did elaborate on the effects of the screen exposure time on the nervous system and HIV. If not, could you please elaborate a little?
So I think one of the issues with screen time is this constant flicking from thing to thing and the use of algorithms. So if you have a child who's a bit depressed or anxious, and that's what they're looking for, the algorithms pull them further and further and further into that state. And the material, the brain, I don't think distinguishes between reality and what you're presenting, via images. And so you can actually sort of traumatize yourself by going down these internet holes. And I think, I don't know that somebody's done a study of that, but because you're exposing yourself to material which is often traumatic, especially if kids go down the hole of pornography, which is a huge issue these days, I think you're actually exposing yourself to traumatic material. And then I think your body responds the same as it would to, other trauma, whether it's, family trauma, whether it's, war trauma, whether it's sexual trauma, whether it's so I think the body responds, to traumatic material in similar ways. So I suppose that would be my response to that. And it's a real issue for young people because technically they live in a safe world, but what they're exposing themselves to is often not safe. And so that's a reality for what the brain has to respond to, what the brain and body have to respond to.
Thank you. We got another question from Johanna that reads, and you might have addressed this partially. So, Melissa earlier, has any research examined HRV changes during tactile therapies, such as clay work, somatic therapies, or haptic interventions? Either of you know if there's anything in terms of HRV research that touches on this? Sadly,
people have tried to look at some of the somatic experiencing type psychotherapies. I think there may be a little bit of research there, but I think, a lot of these techniques of using like interoception, of using sensory interventions, of using bottom-up regulation, a lot of that is fairly recent, and I don't think I think it's an emerging area of research. Yeah.
Thank you. Let's go to our next question, which reads, how do you support the transition from resonance frequency breathing as a structured training method to flexible, context-sensitive self-regulation, where clients can recognize internal cues and adjust their breathing without becoming dependent on software or external paces? Melissa, do you want to go first with that?
I would just say that it can take quite a lot of time. And having that, the beauty of HRV is that it can kind of bypass some of the issues with language and with formal education levels and things like that, because somebody doesn't need to understand autonomic physiology to see that when they when the green starts to get bigger, that they start to feel calmer, or that if they start to talk about something that's distressing, then that coherence goes down. I think that is probably the most powerful part of HRV, is when clients actually have that moment of seeing their physiology changing because of something that they are doing. And in my client's case, that really, really firm belief that nothing was ever going to get better was really challenged when she could actually see that things were, even for a moment, getting a little bit better. And I would say things like, you can see that for the last 5 minutes, your nervous system has had a little holiday from all of the pain. So HRV really, it can be really affirming that that there is some hope of healing or improvement. And I think once you have opened that door, then clients like my client can be a lot more motivated to go further with that and to start trying to do those things in between sessions on their own, you know, from whatever toolkit, you know, they have access to.
No, absolutely. Certainly something that I've observed a lot in my own practice. I use, the tool as a tool to get that connection, and
Yeah.
then um, and then use other things to enable them to practice different methods, and until they begin, they become incorporated into, other areas of their lives. Do you want to comment on that, Cassia? So certainly what
Yeah,
you
yeah.
said.
So I think so mine, we get kids with functional neurological disorder, and the research is very clear that they have activated autonomic nervous systems. Their heart rates are higher, heart rate variability is lower, and the brain responds differently to things at that level of arousal. So one of the issues for us is we're always doing regulation strategies to try and down regulate the system. And I think from when working with kids, I think it's also about flexibility, that there's different ways to get the same thing. So some of them love getting the heart rate variability feedback. They love having that direct visual, and that's great. Other kids just fight against that. And so you have to be creative, whether you use some sort of sensory tool to get into a state of calm, or whether you use movement meditation. Some of them love movement meditation. You're doing the breathing with movement, and you've done a little meditation, and then they suddenly say, oh, that makes me feel calm. So I think it's around being flexible, having different ways for different people, so that they can actually then take with them, what works for them. Because if they don't like it, they won't do it. And you really want them to be doing it and regularly practicing. So that would be my response. Yeah.
Thank you. Let's go to our next question, which comes from Julie Titsov, and reads, how does science know where and how to stimulate vagus nerve with the implants that you spoke of about in the beginning? And I think this is really addressed to you, Cassia.
So
Are
I
these
sorry,
implants?
can you say that again? I just sound
Yeah,
just I
yeah,
missed
sure.
I've missed the first part of the question.
Yeah, I'll read that again. How does science know where and how to stimulate vagus nerve with the implants that you spoke about in the beginning? And are these implants interacting with vagus nerve that goes to the heart?
So the vagus nerve that they're stimulating is the afferent. So if you remember that I showed the little boy figures, and I showed the afferent nerves that go from the body to the brain. So what they're trying to stimulate is those afferent nerves. So they're actually stimulating the vagus nerve, but what they're trying to get is the flow-on effect for how that then changes the processing in the brain. So that's what they're doing. Yeah.
Thank you. And the next question, I think, is also addressed to you. Well, it is definitely addressed to you. It reads, please, can Cassia help me understand how the two categories of parasympathetic nervous system, the blue restorative versus the purple defensive, map onto ventral and dorsal that is used in popular understanding of the vagus nerve?
Yeah. So I think Stephen Porges, has used the vagal and the dorsal, and I think that's been, there's been other scientists who work in the area who have for many years, sort of said it's not as straightforward as that. Like the anatomy it's not as simple as that. And I think a lot of people have then started using these as if it's an actual anatomical categorization that everybody agrees with. So I actually, very early on, I didn't use Stephen Porges's, anatomical way of talking about it because I knew there was significant disagreement in the field. And in fact, there's been a recent paper by Grossman, long paper. It's in one of my article, one of the references, who have, come out with a whole group of people and saying these are all the things we don't agree with about polyvagal theory and how that's been, how that's been put forward. So I was very clear in my presentation that it was a functional diagram of the autonomic nervous system because it's about the function of the nerves. We know that there's, part of the vagus nerve that has a restorative component. It's about regular function. It's about keeping the heart going. It's about keeping the gut going. It's about regulating the organs. But we also know, and we know that from research, that there's certain fibers when an atom is stimulated, they would cause a defensive response. So there's also fibers whose function is defensive. And I've just talked about it functionally, that there's these blue fibers that are restorative and the purple fibers that are defensive, because we know that the vagus nerve has these functions. But I've avoided using some of those distinctions that polyvagal theory has made, just because I've known for a long time that there's actually a whole lot of debate about that. So does that help?
I hope it does. Certainly, a question came from Julie Titzel, but I think it really helps. Your Saffron's light on absolutely an area that there's a lot of debate, and probably we're likely to continue to see debate as we gain more data and there's more studies
but there is no debate about the function. So that, in fact, we know there's these restorative functions. We know there's these defensive fibers, but we don't, as working in clinical practice, it doesn't matter for us whether they come from exactly this nucleus or that nucleus. We don't need to be pulled into, that whole conversation. And I've always tried to stay out of it because just because I knew there was a controversy. By people, scientists who actually they want to be right, correct. They want to get the stuff correct. And so if they think something's not correct, they're going to debate it and say, well, actually, that's not right. That's not what the data shows. And so there's a whole background discussion like that. And if anybody wants to, look at that, they can read the Grossman paper, which is a critique of polyvagal theory. But that doesn't mean that the basic functions of the autonomic system aren't as, we've talked about them today. But we don't have to get, obsessed about exactly which nucleus, because from our level in clinical practice, we don't need that level of precision. But we also can't talk about it in a way that's scientifically wrong either. So, yeah.
Absolutely. And that applies to so many areas of our work, doesn't it?
Yeah.
We got just a couple of minutes left. So I might go to a question by you, which reads, could you comment on the dive response in vagal stimulation?
So the dive response is a reflex. And the reflex is that when we put our heads in cold water, our heart rate goes down. And that's part of the defensive response because you can't breathe underwater. So you have to hold your breath. And that's a very well researched response. And of course, people use that knowledge in DBT and other regulation spaces where people use ice or putting cold water on their face to try and activate what is a vagal response. But it's a defensive response. It's because we can't breathe underwater. We hold our breath and, our body has this way of protecting ourselves. Yeah. So they're harnessing a response.
Thank you, Kathy. Um, okay, I've only got a couple more questions, and I might just throw this one to you, and then maybe I can encourage you to just, make some, um, you know, conclusion statements, particularly about the value of incorporating the whole notion of HRV, but also, some of the tools that we have at our disposal, like, the EM wave that Melissa talked about before. So the question is, how sensitive is HRV in detecting moment-to-moment shifts in autonomic regulation during tactile or sensory motor interventions? Any of you like to?
I'm not sure about the tactile and sensory motor interventions, but certainly you can see moment-to-moment changes in heart rate variability. And you can map those quite closely to what you also observe the client is going through or listening to what the client is saying. So yeah, I imagine that you could use that moment-to-moment value in that same area of the clay fields. Love all of the pottery questions. It's a few potters it starts.
Of course, you have to use the sensors.
Yes.
Any concluding statements about, particularly about the value? I think that one thing that surprises me is is that the use of HIV in general, but particularly some of the biofeedback sort of the ways that it gives us a window into what is happening. They illustrated so well in your presentation, Melissa, that have not been as widely taken up, as I would have expected when the
Yeah. And, I think sometimes when you are trying out a new modality, you can get stuck in, if you're doing it right or if you should be doing it in a more structured or less structured way or things like that. But basically, I think the real value for HRV for me hasn't been the client's performance in HRV or any of those things that I just mentioned, but helping them experience that their nervous system is capable of change. And for, survivors of complex trauma, that is just, that profoundly empowering.
Thank you.
And
Cassian?
my comment, I think, was the same. It's around mastery, and I think sometimes getting that feedback, I think, feeds into the issue around, oh, I can actually do this, I can influence, I do have some control, and I think that's very powerful, because with trauma, feeling a sense that your body is out of control. Actually bringing the mastery back in, that you can do things that will calm your brain and body, and that gives you a pathway towards healing. I think that's very, very powerful. Yeah.
Thank you so much. I've certainly been pushing this, for the last 20 years since I discovered it myself, and I found it gave me, such a great shortcut, to do some of the things that sometimes, would take a long time, using other methods, and also a terrific way to explain to clients, some of the things that they're experiencing. So thank you so much. It's been a fantastic session, and it's been very well attended, more than 200 people today. And thanks everyone for your attendance.